Hi everyone, this is Will. Today I'm going to present you the Gestalt therapy. Both roles, Dr. Ken and Ben, were played by me. Let's get started. Well, Ben, I really appreciate you being here today. I understand that you have some feelings and emotions about your brother that you would like to talk about. I'd like to hear about them. Well, I'm having a hard time dealing with losing my brother. He died in a car crash a few weeks ago, and well, our last encounter wasn't very pleasant. We were in an argument. To be honest, we didn't talk after that, and 5 days later, he was gone. I love my brother very, very much, so his past was devastating for me. But at the same time, I felt so bad that our last encounter was an argument. Oh my god! I'm sorry. I just can't control myself. It's okay, Ben. It's okay. I can tell that you really love your brother from what you're saying, and definitely there was a lot of pain coming with his past. If it's okay, I wish you could tell me more about your relationship with your brother. Right. Well, basically, it's like I said, I love my brother very much. We lost our parents when I was 15, when we were 15, and life was hard for us because we were small. He was 4 years older than me, so to me, he was often this father like figure. He worked two jobs to take care of me and put me through college. We were really close, like really, really close. I see. So since you were so close, what were you arguing then? Before his accident. It's it's just family thing, okay? It's just a normal family thing. Well, Ben, I understand it's a very hard moment for you, but you're looking away and you touch your nose. Those are signs of self-defense and guilt. Well, like it, huh? Okay, I can definitely see some emotions going on. Anger. You mentioned before that you always felt angry. Why don't we talk about your anger then? I'm sorry, I don't mean to. Anyways, after my brother passed, I always find myself being impatient with my family, especially my kids. Like everything they did was wrong, and I just feel like I couldn't handle them. I couldn't tolerate them. Okay. And did you ever feel like this before? No, no, never. I got along with my family very well. I didn't feel like myself when I was angry. Okay, didn't feel like yourself. Well, in that case, I like you to explore your anger, by which I mean experience your anger. Here? Right now? Yeah, if you don't mind. I'd like you to play the roles of your regular self and the angry self. I'd like the two of you to have a conversation. Here, I'd like you to switch between the chairs I provided you here as you switch roles. If you're ready, you can say what you want to say as the regular self to the angry self. Okay, to be clear, you want me to, what? Be the regular self now and then switch to respond? That's precisely what I want you to do. Okay. Um, okay. You need to calm down. I don't like the way you ask me to behave. I don't like the things that you do to me, okay? I don't like it when you yell at my boys for no reason at all. What you did is unacceptable, okay? And you just got to stop. And you want me to switch now? Yeah. If you know what the angry self would respond, sure. Just remember, though, that the angry self is not as rational and calm as the regular self would be. So he would, I assume, speak with a different emotion or voice. All right, all right. Um, Angry self. Okay. What do you mean you don't like what I did to you, you coward? The boys needed to be treated like that so that they know who's the boss. I'm here to help. I made you stronger. I don't need you to make me stronger, alright? I am strong. I have a great family and I do whatever I can to support them. A great family? Don't you remember how your brother ordered you to do this and that? In front of him, you're just like a kid, not a man. Damn it. Damn it. Ben, you touch your nose again and you look emotional. What's going on with you and your brother? Doctor, I don't want to talk about it. My brother is a good man. I could have died without him. I owe him everything. I have little doubt about that, Ben. But after this is your life with your own decisions. You're responsible for your own life. You still want to become your regular self, right? Yeah, I do. Fine. My brother, he's very commanding, right? He gave instructions that I had to follow. He reviewed every decision I made since I was a teenager. You know which college to go, what job should I get, everything. And after I had my own family, he would still come to my house and just point out what I've done wrong and what I should have done. Everything. How I'm supposed to teach my kids, what should I hang on my own wall, everything, you name it. I can feel that, Ben, you have a strong but pretty mixed feeling towards your brother, right? Yeah, you're right. I don't like to feel like a child in front of my brother and definitely don't want to be like that or do that to my own kids. I guess I'm angry about how he points fingers at my life. But at the same time, and it breaks me to think that our last encounter was an argument. Well, Ben, I think it is your introduction to associate your argument with your brother's death. Your brother is responsible for his own life. He make decisions that has consequences on his life, and so do you. So I'd like to think about how you are responsible for your life, how you teach your kids or what to hang on your walls. The fact that your brother raises you, it seems to me, became a burden for you to interact with your own current life. Doctor, I think you have a point here. Just realize sometimes I was using my brother as an excuse not to take responsibility for my own life. I guess that's the case. And maybe I was hiding, from the past between my brother and I. What matters to you, Ben, is now, right? The past is the past, but this burden has become a huge difficulty for you, during your interaction with your current life, with now. How do you feel? Like how you feel now after you have explored the reason why you're angry? Tell me more. But at the same time, I'm very glad that you've overcome yourself to, confront your anger. Thanks, doctor. I feel like I was always hiding the past, but now I want to come out of it. I have so many feelings that I want to talk to about my brother, and I want to let him know how I felt, how I love him and miss him. But now it's just too late. He's gone, right? Well, maybe it's not, Ben. You can still express those emotions, and I believe it's important for you to express them. But let's leave it to the next session, if possible. I like you to think about what we talked about today and see what else might come to you, after our next section. But we will definitely continue with this unfinished business with your brother. Okay? Okay, thanks, doctor. Okay, so this is the end of the presentation. If there is to be a part two, that would be where Dr. what? Sorry, I forgot. Uh, Dr. Kent, right? Dr. Kent. The Dr. Kent, I assume, would recommend the empty chair technique, which involves Ben talking to his brother. Imagine him talking to his brother. So there would be an empty chair put in front of Ben, and Ben would imagine that his brother was there and talk to him. This method was supposed to resolve the unfinished feelings that Ben had with his brother. And the technique I used, the technique Dr. Kent used in the first scenario was called the two-chair technique, where Ben was switching roles to explore something about himself. So it's more about like finding what the problem is, the self-conscious awareness of the emotion that he was having. And after that, we clarified, we found out that it was all about his brother. And after that, we resolve that conflict, that problem, that unfinished business. But for the sake of time, I'm not gonna present that. But like I said, empty chair technique, in order to resolve the emotions, the reasons behind the emotions. So just in case someone hasn't read about Gestalt therapy, it's raised by Fritz Perls. And the core belief of Gestalt therapy is the idea that reality is often clouded over by unfinished business that we had with the past, and it is therefore necessary to urge or sometimes even push client to experience the now. And Gestalt therapists believe that awareness equals to reality, and that individuals tend to avoid unfinished business. Therefore, it is very important to push, urge. Like sometimes the old school Gestalt therapist push client very, very hard. They push them to confront the pains and hurts, the feelings, in a pretty not very humane way by today's standards. And so that's it. Confrontation that we just talked about. Another key element of Gestalt therapy is the fact that people often seek external support, including the use of nonverbal behavior. So it is important for Gestalt therapists to sometimes observe those nonverbal behaviors, like the facial cues, or micro expressions on the face, and those would be very helpful in the diagnosis and confrontation process of the therapy. So I think that's it. Thank you all, and please stay safe and have a nice one.